Hi, I'm Dr. Bryce Benson. I'm with Northern Lakes Chiropractic, and I'm here to talk to you about TMJ pain and what are the options when you have TMJ pain. So I like to start at the top of the list and the most invasive things that happen with TMJ, and that's a total TMJ replacement. And that's when they'll go in and actually replace the entire TMJ joint and completely reconstruct it. The next is an open joint surgery, obviously a little less invasive than the total replacement, but we're going to be repairing some damaged areas, moving the disc around, and then also trying to realign the joint itself. The next, arthroscopy, where they're going to be just going in to actually clear any scar tissue along the joint. Those are kind of like the top tier as far as the most invasive that you can have. The next ones I'd like to talk about are kind of like the next one down, I'll call it like tier 2. So the first one is injections, when they'll do an actual prescription medication injection into the joint itself. Medications, which are a lot of like NSAIDs, drugs, muscle relaxers to help just kind of calm the area down. And then there's oral applications too, which, like mouthguards and even splints they can use to try to keep the area in the right place. So we have tier 1, tier 2, and then tier 3 is usually the lowest tier as far as invasive. So these ones commonly are PT, massage therapy, dry needling, acupuncture. But one of the ones that work so well that people typically overlook is chiropractic care. Because chiropractors deal with joints all day, we can adjust your wrist, elbow, spine. The TMJ joint is no different. It's a joint that gets stuck, isn't moved properly. And what we do is we go in, find where it's not moving, get it in proper motion again, and really help alleviate that TMJ pain. So if you have TMJ pain, it's a great idea to come in for the first day so we can evaluate exactly what's going on, figure out how we can help correct that TMJ pain, and making sure it stays away.